and welcome to day 2 of the THT Providers Forum 2021. Day 2 is dedicated to our providers in the northern region, and we are glad to have this exciting moment with you today. In a few minutes from now, we will begin the session officially. Please stay tuned and join us as we all through this engaging session together. It's going to run from 10 to 1, and I can guarantee you you're going to enjoy every minute of it. We have engaging speakers, we have moderators to take us through each and every one of the sessions. Please stay tuned and make sure you grab everything that you can to make this session worth it for you. Thank you very much, and stay tuned.
That's Adamu, our regional sales executive. You can call him a globetrotter. He travels to different cities closing deals. Today in Abuja, tomorrow in Johannesburg, next day in Sydney. Never fails a day because his health is secured. It's really easy to travel the world when your health is covered. That's what THT does for us with the international health coverage. We cherish our staff, and it's our job to keep them healthy with Total Health Trust HMO while they do what they love. Total Health Trust, working to make Nigeria healthier. Terms and conditions apply. That's Adamu, our regional sales executive. You can call him a globetrotter. He travels to different cities closing deals. Today in Abuja, tomorrow in Johannesburg, next day in Sydney. Never fails a day because his health is secured. It's really easy to travel the world when your health is covered. That's what THT does for us with the international health coverage. We cherish our staff, and it's our job to keep them healthy with Total Health Trust HMO while they do what they love. Total Health Trust, working to make Nigeria healthier. Terms and conditions apply. Amaka is up and running, getting ready for the day. She manages our customer service function every day, and she's passionate about it. After another exciting day at work, Amaka is set to go home. But on our way, she starts to feel feverish. She knows she has to seek medical care before it gets serious. With knowledge of THT network of hospitals around her, she alights and walks into a nearby health center and accessed quality healthcare. Having quick access to quality healthcare had never felt better. Total Health Trust, working to make Nigeria healthier. Terms and conditions apply.
And there you have it, Total Health Trust. We're working, always working together with you, our providers, to make Nigeria healthier. Every day, every minute, every moment, every week, every month, every year. This is our purpose, this is who we are, and this is what we do. We cannot achieve this without working with you, and we are extremely excited and grateful that you are here with us at this session today. So immediately, without taking any much time from you, we are going into the session. So please sit back, get your notes and pens, and be ready to participate in the session to get the best value possible from your time spent with us today. Thank you very much, and stay tuned.
Hello and welcome to day 2 of the Total Health Trust Provider Forum. This forum is unlike any other that you've attended. Our event today is focused on the movers and shakers of the healthcare industry in the northern region. So we're very, very excited to have you join us. My name is Victoria Makanjola, and I'll be one of your hosts for today's event. Our theme this year is Creating Impact in Chaos, Healthcare Resilience Lessons Post-COVID. Our aim with today's event is not just to talk about going through a pandemic, but to highlight key resilience lessons that our industry can learn from the pandemic so that we can offer better healthcare systems, better healthcare delivery, and better access to care. So yes, welcome. Before we begin, I would like us to note a few things. Please do mute your microphones. Please do turn off your videos so that we can have a seamless session. Also, if you're having challenges with any of the platform in which you're joining us, please note that we have alternatives. So you can either join us on YouTube or on the Teams app. We'll be dropping the link to access either of this platform in the comment section or in the chat box. Also, it's not just about sharing knowledge today. We're also offering exciting goodies. So we do have a lucky dip for facilities. Please, we require a representative of each facility to please drop the name of your facility and the location of your facility in the comment section or in the chat box, whichever one applies to you. And one of our executives will be in touch to assign your facility with a number. This number is extremely important because only facilities with number can access our raffle draw and stand a chance to win one of our amazing goodies. So don't miss out on that. I know the doctors are thinking, what about us? Are we not getting anything? Apart from offering you exciting sessions and knowledge and insights, we're also giving you CME points. So please go to the comment section or the chat box and fill a form with your name, email addresses, and your phone number so that you can stand a chance to win some of our CME points. Without further ado, can we get into this session? Please make welcome with me for his opening remark, the CEO of Total Health Trust, Kieran Gordon, for his presentation.
Good morning to everybody. As said, my name is Kieran. I'm the CEO of THT. So a very big THT welcome to every one of our providers to this, the 2021 Provider Forum. This year, as you know, we're obliged to hold a virtual forum due to the ongoing pandemic and these existing COVID-19 protocols that we all have to live with. I'm positive, though, that this will be an exciting, insightful, and rewarding session for us all. The theme for this year's forum, as we've said, is Creating Impact in Chaos, Healthcare Resilience Lessons Post-COVID-19. As economies and businesses emerge from the scourge of the pandemic, innovation and resilience become extremely important for growth and sustainability. As healthcare providers, you remain at the forefront of this development. The world is depending on the success and the resilience of the health sector to breathe light into the darkness and perhaps return to the moments we shared freely without physical distancing. Unfortunately and very sadly, the pandemic is still very much with us, and I urge all of us to continue to take precautions, not to lose hope, and not to give up. Even more sadly, and just as an example of how close the pandemic remains to us, we lost the husband of one of our staff members just this morning to COVID, and my appeal then to everybody again is if you haven't been vaccinated, please do so as the second phase of vaccinations rolls out in Nigeria. These discussions at the forum are important to us at THT as they help us understand your challenges and how we can work together with you to make Nigeria healthier. A healthier Nigeria is good for us all, good for the economy, and certainly good for all of our businesses. Our purpose revolves around this, and you as our provider partners are an integral part of this mission. We have an exciting and informative lineup of presentations and panelists, and I invite you to participate fully in the day. We also have giveaways during the day to create some fun in between the business. Once again, on behalf of all the staff and the management at THT, welcome and enjoy the session with us.
Please let's give a warm applause again for our CEO. I think that one of the things that he said that struck me was that the world is depending on the healthcare sector to shine light in these dark times. So you're here today because the world is depending on you, not just to shine your lights, but to help us to be better, to help us to survive these trying times. So today we do hope that you learn some lessons in resilience, and we do hope that you take away some key things that we can do to be better people and to be a better country. We're going to have some brand materials now and welcome you to THT, introduce some of our brand values to you. So please sit back and do enjoy.
I have dreams for my future and my family. I dream about building my own business. I dream about traveling the world. I dream about watching my children growing up and celebrating important milestones with them. I dream of growing old, content with my spouse. I dream about seeing my grandchildren take their first steps. But life is uncertain, and the health of our loved ones is our only true wealth. What if my child got very ill? What if my spouse needs surgery? What if we had a serious accident? What if we had a challenging pregnancy? Medical cover is so complicated. I'm not sure I would know what medical treatment we could get, from whom, and what it would cost. I wish I could have peace of mind that I can access the care we may need now and in the future. I wish medical cover was easier to understand and easier to access. At Liberty Health, we understand that worry is a thief of joy, which is why in your country and across Africa, hundreds of thousands of people have accessible, affordable, and understandable medical care. They can enjoy the present and have the peace of mind that if something bad happens to them or their family's health, they are covered. From taking care of your everyday health to serious conditions and emergencies, with us, you are covered. Whatever benefit plan you're on, so you can focus on cherishing every moment with your family. Liberty Health, working together to make Africa healthier. I have dreams for my future and my family. I dream about building my own business. I dream about traveling the world. I dream about watching my children growing up and celebrating important milestones with them. I dream of growing old, content with my spouse. I dream about seeing my grandchildren take their first steps. but life is uncertain, and the health of our loved ones is our only true wealth. What if my child got very ill? What if my spouse needs surgery? What if we had a serious accident? What if we had a challenging pregnancy? Medical cover is so complicated. I'm not sure I would know what medical treatment we could get, from whom, and what it would cost. I wish I could have peace of mind that I can access the care we may need now and in the future. I wish medical cover was easier to understand and easier to access. At Liberty Health, we understand that worry is a thief of joy, which is why in your country and across Africa, hundreds of thousands of people have accessible, affordable, and understandable medical care. They can enjoy the present and have the peace of mind that if something bad happens to them or their family's health, they are covered. From taking care of your everyday health to serious conditions and emergencies, with us, you are covered. Whatever benefit plan you're on, so you can focus on cherishing every moment with your family. Liberty Health, working together to make Africa healthier. I have dreams for my future and my family. I dream about building my own business. I dream about traveling the world. I dream about watching my children growing up and celebrating important milestones with them. I dream of growing old, content with my spouse. I dream about seeing my grandchildren take their first steps. But life is uncertain, and the health of our loved ones is our only true wealth. What if my child got very ill? What if my spouse needs surgery? What if we had a serious accident? What if we had a challenging pregnancy? Medical cover is so complicated. I'm not sure I would know what medical treatment we could get, from whom, and what it would cost. I wish I could have peace of mind that I can access the care we may need now and in the future. I wish medical cover was easier to understand and easier to access. At Liberty Health, we understand that worry is a thief of joy, which is why in your country and across Africa, hundreds of thousands of people have accessible, affordable, and understandable medical care. They can enjoy the present and have the peace of mind that if something bad happens to them or their family's health, they are covered. From taking care of your everyday health to serious conditions and emergencies, with us, you are covered. Whatever benefit plan you're on, so you can focus on cherishing every moment with your family. Liberty Health, working together to make Africa healthier. I have dreams.
Everyone wants the best things out of life. The best friend, the best partner. At Total Health Trust, we understand partnership. Like friendship, it's about giving and commitment. There is nothing better than having a great partner with a great purpose. Purpose fuels, purpose drives, purpose enables. At THT, we move and breed our purpose, working together to make Nigeria healthier. We cannot promise that life won't be tough, but you can be assured that healthcare can be easy. Whatever life throws at you, you shouldn't have to bother about your HMO. The reason is obvious. We're committed to you. We put you first. We feel what you feel. We walk the talk and show up through the good and bad times. You can count on THT as your reliable partner. Strong and kind, resilient and responsible, experienced yet modern. Our purpose is simple. We're here to make you healthier. Everyone wants the best things out of life. The best friend, the best partner. At Total Health Trust, we understand partnership. Like friendship, it's about giving and commitment. There is nothing better than having a great partner with a great purpose. Purpose fuels, purpose drives, purpose enables. At At THT, we move and breathe our purpose, working together to make Nigeria healthier. We cannot promise that life won't be tough, but you can be assured that healthcare can be easy. Whatever life throws at you, you shouldn't have to bother about your HMO. The reason is obvious. We're committed to you. We put you first. We feel what you feel. We walk the talk and show up through the good and bad times. You can count on THT as your reliable partner. Strong and kind, resilient and responsible, experienced yet modern. Our purpose is simple. We're here to make you healthier. Everyone wants the best things out of life. The best friend, the best partner. At Total Health Trust, we understand partnership. Like friendship, it's about giving and commitment. There is nothing better than having a great partner with a great purpose. Purpose fuels, purpose drives, purpose enables. At THT, we move and breathe our purpose, working together to make Nigeria healthier. We cannot promise that life won't be tough, but you can be assured that healthcare can be easy. Whatever life throws at you, you shouldn't have to bother about your HMO. The reason is obvious. We're committed to you. We put you first. We feel what you feel. We walk the talk and show up through the good and bad times. You can count on THT as your reliable partner. Strong and kind, resilient and responsible, experienced yet modern. Our purpose is simple. We're here to make you healthier.
Brand materials. We hope that you enjoyed some of our brand materials and that now you know us a little better. Please note that if you have suggestions, questions, or contributions during this session, please put your comments in the comment section or in the chat box. We want to hear from you. Please join me as I welcome the woman of the moment, the head of the Provider Management Unit of Total Health Trust, Dr. Chianka Aguboshim, for our opening presentation.
Good morning, everyone. My name is Dr. Chinyaka Aguboshim. Today we will be talking about, welcome everyone and welcome all the providers to THT 2021 Provider Forum. We love you, our esteemed provider. That is why we have organized this forum with the team Creating Impact in Chaos, Health Resilience Lesson Post-COVID-19. And the purpose of the forum, this forum is what we hold every year. The purpose of the forum is what offers us opportunities to interact with our providers. And by interaction we get from this, it gives us insight on what we do to make you better, to forge a better partnership while promoting your interests. And for the purpose of this forum again, we all know that since last year, the whole nation, the whole world has experienced a lot of chaos like we have never experienced since the last World War. The last pandemic I know we had was about a century ago. And this chaos that has overtaken the world is what we looked at because a lot of things change. And that's why most people captured it in the expression we call new normal. I'm sure you're not hearing new normal for the first time. Because new normal, saying something is new normal, it means it has changed virtually everything we do. The way we think, the way we work, our personal hygiene, our relationship with people. People no longer attend parties where there are crowds. People watch what they do. When you come in an environment, you know you are supposed to use something. And in the light of this, that was why we got this team, Creating Impact in Chaos, Healthcare Resilience Lesson Post-COVID-19. And I think this team can be termed perfect in this occasion. As all of us are players of the industry, we are apart from that, there are chaos. I am sure there are positive developments that have happened in the midst of this chaos, and all of us can also find relevance across board. We have assembled a lot of resource persons from different sub-sectors of the economy, of the health sector, and everyone is coming to say things that will make us, all of us, happy today. And I want to talk about 3 key things that is very important in this program. Those key things are chaos. You can't talk about chaos without talking about impact, because when there is chaos, you expect you have to solve the chaos. So I'm talking about chaos, impact, and clarity. I'm sure somebody wondering what is clarity coming in to do in chaos. When you talk about chaos, like we all had last year, chaos is a state of disorder of confusion. Last year when COVID came, everyone was in the state of confusion, especially even the WHO. People didn't understand what was happening. Nobody knew what was happening in the country. We didn't understand anything that was happening, and we didn't actually know that such things could actually be a problem. So we are just in helter-skelter. We are in chaos. We didn't understand what we are going to say. And that was why today we termed this thing Creating Impact, because what impact have you done? When you now talk about impact in this situation, I would say impact is having effect on something. It could be a positive effect, it could be, but most times, as in the context of our discussion today, impact means a positive effect on what we are doing. And I also want to say that when you talk about clarity, if you look at clarity, somebody can say, see, me being coherent. So even in the face of issues, you are coherent, you are intelligent, you are thinking of what you need to do. It's easily understood. So by clarity amidst chaos, I would say that when somebody, even in the midst of chaos, you're able to remain resolute, you're able to do things, you're able to remain calm to achieve your set organizational goal. That's exactly what clarity amidst chaos is talking about here. So you're able to remain steadfast. You're able to do your things even without letting people know that we are doing that. You're able to continuously make the right decisions. You're able to take care of your patients. You're able to use the right attitude. I'm not just talking about the MDs of hospitals. I'm also talking about the staff of hospitals. When the chaos come in THT, I know that normally we wouldn't have known that we can work from home. Even with that, THT has become an ally. We have remained steadfast with our providers through thick and thin. And this has also brought us the kind of resilience that we use to navigate chaos. And I know prior to pandemic, if they had told anyone that we are going to be working from home, somebody would have, from each and every one of us, wouldn't have thought that things were going to be possible. But with what we have talked about today, what we are talking about today, we have migrated from THT. There are some lessons I know that we should also learn from THT. Because one of the things is that even this event that we usually have it every year, and it's usually physical. We have migrated this program from the physical events to a virtual event. And we have successfully been able to do a lot of things from home. And also, even from claims, we have been able to process claims at home. We've been able to do reaccreditation and reaccreditations at home. And we're also able to do reconciliation and some other things we're able to do from the home. Even at a point, we're able to even manage our contact center from home. So in response to the increasing cost of healthcare resources and the associated costs with those healthcare resources, THT have been able to review their tariff since the pandemic, and we have remained flexible enough. We have always listened to our providers. We have maintained quality-based services, even though there is chaos. And also, what else? Another thing that we have also done in THT is that we are able to provide PPE for providers. Some of our providers, and the PPP ran through the months of April to November 2020. And this also helped us to safeguard our providers while they are still providing care for us. And also, there are a lot of things that we have done. So we are urging every one of us that in THT, when we looked at what happened, we looked at it and said, this is what we are able to do. How do we work from home? How do we manage the situations? Because people have paid in their premium to us, and we must content them. We must make sure that we manage them well. And based on that, we're able to create things, innovate things, to make sure that things are still moving. So I'm urging our healthcare providers, please, like our CEO said earlier, the pandemic is still on. Don't let us fail. Don't let us lose our guard. Things are still happening. The golden rule should also be there. We should be able to wash our hands. We should be able to maintain social distance wherever we are. If you are sick, please don't mix up with people. If anything is happening, please make sure you don't mix up with people. Make sure that things go well in your organizations, because that's the only way you can actually take care of our patients or our members that we have entrusted in your care. So as THC that we are, as part of the things we used to make Africa healthier, I urge every one of you to stay tuned, because there are a lot of freebies to be won. We have a lot of things. The event is going to be very rich this time around. So I urge everyone to stay well and stay tuned. Thank you.
Thank you, Dr. Chianka. So we're going right into our first presentation of the day, and that will be by Dr. Okechukwu Uzim. Dr. Uzim will be talking to us about medical practice in the COVID and post-COVID era. Before we begin, I'd like to acquaint us with Dr. Uzim's profile and just a little bit about his work and what he does. Dr. Okechukwu Uzim is a consultant, physician, cardiologist. He has worked in several places, including Lagos University Teaching Hospital, Redington Multi-Specialist Hospital, and Goodshaw Hospital, University of Cape Town. He's also a member of American Heart Association and American Stroke Association. Please, if you are ready for Dr. Uzim, I want you to drop a comment in the chat box and say, "Welcome, Doctor." Can we welcome Dr. Okechukwu Uzim for his presentation?
Okay. Hello. Good morning, everybody. Thank you very much for the warm introduction. I'm Dr. Okechukwu Uzim, the consultant cardiologist, and it's my privilege to be able to join this meeting today and to share a few things with us. Okay, I will just prepare my slides so I can start sharing. My slides from here. Okay, good. So I hope you all can see the slides. So the title of today's topic is medical practice in COVID times. This is basically looking at how our practice, the shape our practice is going to take during this COVID period and possibly post-COVID times. I think the whole scenario and the whole scene has already been set with the onset of COVID. Okay, so of course we've been told. So what the outline is going to be a brief introduction, outlining what the COVID era is, its origin and its developments. We're also going to look at how our practices. What are the changes we expect to happen in our practices, and what are the major concerns about safety and other things that should bother us about our practices? Of course, patient and staff safety is paramount. Telemedicine and telehealth services has come to stay with us, which include video visits, telephone visits, remote patient monitoring. A lot of developments have happened around this, so we're going to talk about them very shortly and in some degree of depth to be able to see how things are happening. And as the practice is changing, so we also have to talk about billing and reimbursements for telehealth services, especially since we're talking about providers forum with one of the leading provider services. Okay, so As a brief introduction, I would like to talk about the COVID era. As we are all aware, um, the SARS coronavirus 19 erupted, was first noticed in the Chinese city of Wuhan in late 2019. And of course, that's where it got its name from, the SARS coronavirus 2019. It infected the whole world in early 2021 as a pandemic, of course, subsequently leading to millions of deaths worldwide. The world didn't take it so serious at the beginning because they thought it was just going to be limited to China. But China continued quickly, and because of globalization, it spread very quickly to Europe. And the world woke up when the Europeans started dying very in untold numbers. Um, I would say that in its current evolution, untold measures have been adopted worldwide in medical and non-medical institutions. So in many medical institutions, changes have happened. In non-medical institutions, changes have happened. Um, the non-medical institutions, things like what they call WFH, work from home, has been instituted. Of course, we also have social infection control strategies, which have been instituted, but it's not limited, especially in the healthcare sector and the non-healthcare sector as well. But which has been, I think we've heard it all too many times, but I'll just repeat it just for emphasis sake: social distancing, remote working, that's working from home, frequent hand hygiene, which includes hand washing, and hand sanitizers, and of course, different social etiquettes. Um, so, what has been the healthcare response? The healthcare industry, the healthcare providers, what has been our response to COVID 19? So, I would say in medical practice, the many measures have been taken, and I will just outline the major two. So, the major two measures that have been taken will include infection control infection control measures, which includes hand washing and sanitizing, adequate patient screening, and prevention and treatment of COVID-19 disease, of course, and isolation practices. And prevention and control will also include all the immunization strategies and vaccination strategies that have been outlined. For my particular topic, I'll be focusing more on the second aspect of the medical response. So, how has the healthcare sector changed? As I said, the first has been the various infection control measures, and the second major change has been the increased utilization of telehealth and telemedicine modalities. So, we'll be looking at what has telehealth brought to us, what are its numerous advantages, and how can we key into this change, which is a positive change that's come into medical practice. So, key components of the telehealth and telemedicine modalities include remote patient monitoring and remote patient care. So, we're going to look briefly at this last two. As I said, the infection control measures, different lectures have been given even by THT in different times past. So I'll be concentrating more on telehealth and telemedicine modalities. Okay. So now, what is telehealth? Well, telehealth basically says the use of electronic information and telecommunication technologies to extend care remotely. Um, as telemedicine, telehealth. Telehealth is more encompassing. Telemedicine basically refers to the medical practice, of course, using electronic means. But telehealth also includes uh, all the electronic modalities and electric and technology that has been built in to enable telemedicine. So benefits of telehealth includes, but it's not limited to, increased continuity of patient care. That means to say, patient comes to the hospital, or whether they are in the hospital or not, they can have easy access to the adequate information they need to keep themselves healthy. Okay, extending medical access beyond normal hours. So with telehealth, previously we couldn't do this. But right now, because of telehealth, this has been enabled. I must also say at this juncture that telehealth and telemedicine has always been around worldwide, but it was not utilized. And at various medical associations, the American Medical Association, the American College of Cardiology, European Society of Cardiology, or European Medical Association, there were this push, especially in the early 2010s, 2014, 2015, for people to adopt telemedicine and telehealth practices, but the adoption was very slow. But what we have noticed is that since the onset of COVID, the adoption of telehealth and telemedicine has skyrocketed and is going to be the same worldwide. So in our country is the same, in many other places the same, but and it has brought with it numerous benefits, and that's what we're just trying to look at. And one of such benefits is, of course, reducing the patient and provider transport burden. The patient does not always have to be in hospital or to wait through traffic to get to hospital to get the list of information about their health, including the lab services or anything. So now patient can be in the comfort of their homes and get the necessary instructions they need to get themselves back to good health when that's possible. Okay, so it also helps provide support for patients with chronic illnesses. So patients with chronic illnesses, hypertension, diabetes, sometimes might be cancer, might be this or that. They're able to access care very quickly, right from the comfort of their home, without subjecting themselves to undue risk of going to a hospital. Enabling patients with underlying issues, of course, receive good care. So these are some of the basic advantages we derive by implementing telehealth services to our current patients. This has not always been the case, but the world and the medical practice worldwide is is transiting from clinic visits or face-to-face medicine when it's possible more to telehealth medicine, especially when that is the better choice. Okay, now, so what are the modalities of telehealth? One, there are different ways telehealth can be conducted. First is the video visits. Video visits, there are many ways. Basically, I appear in a video conversation with my patient. I'll just leave that as that. Okay, we also have phone call consultations. So I can make a phone call to my patient and discuss all his problems, identify what the problems are, and derive a clinical working plan for my patients, which is implemented. If he needs to do some tests, he gets to do those tests. And his medications can be sorted out as per agreed modalities. So that's a phone call consult. We have online communications. Online communications, patients can log onto your website and and do what they need to do. Communicate with you, send you messages, they get a reply, they can read some things up on your website and know what they need to do about their specific communications. Patient monitoring. Patient monitoring is one of the fastest growing area of medicine right now. So before, all patient monitoring took place in hospital, but right now we have many modalities that have been present before, and now new ones are being added to it. Patient monitoring includes home monitoring of blood pressures, we will talk about that shortly, home monitoring of blood pressures, home monitoring of blood sugars these days, pulse oximeters, and the rest. All these ones are helpful to help a patient, of course, for a doctor to be able to know what's happening to this patient and give the appropriate and prescribe the appropriate treatments that the patient might need. Critical about the modalities of health is data recording and storage. Of course, we have various modalities of data recording, but most importantly, these days, we are moving towards the era where we use electronic medical records. Okay, the electronic medical records is quite important. So the electronic medical records is quite important, and we must know that each data we get when we have it, whether it's from a video consult or a phone consult, it must be properly recorded. So that's part of the modalities of telehealth. And we also have what we call the mobile health and the M health, which has of course come to stay. Okay, I hope everybody can hear me clearly. Okay, so the use of mobile health, M health, has come to stay. So there are many ways patients can access healthcare with just a mobile phone that is connected to the internet. Okay. So please, we are, so these are one of the mobile health modalities, and okay, so mobile health modalities, and then I hope everybody can really hear me. So we also have what we call case-based teleconferencing. So sometimes somebody needs to go for surgery, the surgeon, the anesthetist, maybe the cardiologist, and maybe the other specialties that are connected with the case might want to discuss about this case. They don't all have to meet physically. They can do a case-based teleconferencing to discuss this patient and plan the care going forward. Okay, so when is telehealth appropriate? Okay, so when telehealth is appropriate, so it's not all the times we can use telehealth or telemedicine. So there are some times we can also use telehealth. So now, when is it likely appropriate times are generous wellness visits. Somebody wants to go for a health insurance, whatever, a life insurance, and they ask them to go for a checkup. It can be done that through telemedicine. Somebody wants to do their routine company annual medical checkups. They don't have to come to hospital, especially to see the doctor. They can just need to come to run their test. The consultations and the major things can also be done actually online. Okay, patients with chronic medical conditions, of course, they've been seen before. Their conditions have been well outlined, so further treatment can be done online. I mean, through a telehealth service. Of course, dermatology consults. Dermatology consults are very, very appropriate. I already have friends who say, "Oh, I'm a dermatologist. I can do my consults online. Send me the picture of the lesion. Send me the pictures of the test results, and I will talk with the patient, and I'll make my prescriptions, and the patient can get their medicine." So dermatology consults are one of the specialties that quickly goes online. There are many other specialties, even endocrinology, and many other medical specialties have actually gone online. And this ones, and going forward, patients will appreciate it that they can stay in the comfort of their homes or offices, and of course, get the adequate care they need. Nutritional counseling doesn't have to be in person. You can tell a patient about his diet, and they can make their choices via the telemedicine portals. There are some times when it is not appropriate or even less appropriate to use telehealth or telemedicine guidance. One, somebody comes in with abdominal pain. Somebody's complaining of abdominal pain. Somebody picks up their phone and calls the doctor, "I have abdominal pain." You don't know what it is. Can it be appendicitis? Can it be peptic ulcer disease? Can it just be muscular pain or just cramps? Can it be? We don't know what it is. A physical exam here is very, very mandatory. So it's not appropriate to use telehealth in this kind of services. Somebody has a pain or a red eye. We don't know what is happening to that eye. It might just be an acute angle closure glaucoma. This patient needs to be examined appropriately to make the appropriate diagnosis. This patient needs to come to the hospital. Somebody has a gynecological complaint. Somebody has missed a period, or she's having PV bleeding. Then she needs to come in physically and see her doctors. Dental complaints might not be so appropriate too, because sometimes they just need to go to the dentist and see what the problem is and have their problems treated. So in complex cases, in complex cases, so so in complex cases, a complaint that requires multiple specialties sometimes might need to have come to the hospital. So there are different kinds of visits, and I said the most common and the most useful of them, of course, is video visits. All of them are useful, whether it's just by phone calls or it's whether it's by phone calls or it's just by okay, so basically for video visits, We can use, I don't know, some people are having problems hearing. I think the technical people can just help us sort this out. I think it's all clear from my own end here. Okay. For video visits, for for video visits, we can connect. For video visits, of course, we use video apps to connect to patients remotely. It offers a better assessment and evaluation. Teleconferencing on specific cases by multiple specialists can be done via video visits. Okay. Okay, so I'll continue with how can we start and sustain a telehealth practice? Well, first and foremost is to be able to have a telehealth vendor. You need to have an IT backup that can give you a telehealth service. Okay, I'm trying to see how we can. They said the audio quality is poor. I don't know if anybody is hearing me at all. Hello. Okay, so what the first thing to do is to select a telehealth vendor. Okay. So to connect to start, so you have to get a vendor. So consider your current medical electronic medical records. Sometimes it might already have such functionality. So if you already have a EMR system, many of them can easily be upgraded to include video visits or telephone visits, and of course have it transcribed on EMR. So that's one of the first things you have to do. You have to get a possible and portable electronic medical record system. We are now moving post-COVID period. Electronic medical records and electronic medical and telehealth medicine has come to stay. So if we have to keep up with the trends, then we must be sure that we have a good telehealth medical practice on ground. Yes, please.
Hello, Dr. Hussein. Please
Are you
hold
hearing
on,
me?
so that we can address. Yes, we can hear you, but please hold while we
Yes, there are so
address
many
all
complaints.
those
So
who may be
exactly,
having
I'm just
network issues. Please, if you are with us online and you are having network issues, please check your bandwidth, your network bandwidth, or if you are on Microsoft Teams, you can consider joining us on the YouTube link. Just click the YouTube link and join the live sessions on the YouTube link. If you are having challenges with audio and video quality on Microsoft Teams, consider clicking the YouTube link and joining us live on the YouTube link. That should work for you in case if you are having challenges with Microsoft Teams. Also, just so that we do not have cases where we are interrupting Dr. Usim and cutting the flow of his presentation, which you will agree with me has been very insightful. Please drop your comments in the comment section. Just type it in the comment section. We have people in here who will be addressing your questions, your concerns, and maybe whatever other input you may have to share. That being said, please let's not forget the ground rules. Again, if you're having challenges with Microsoft Teams, please consider joining us on YouTube. If you have comments or suggestions or any other input you want to bring, please drop them in the comment section. Thank you very much. Dr.
all right,
Usim,
thank you so
over to
much,
you
IC.
again.
I appreciate. Okay, so as we proceed now, we're going to discuss quickly how can we start our sustain telehealth. Like I said earlier, the first is to be able to select a good telehealth vendor. Your current EMR might be sufficient, or you might have to just upgrade it to include such capabilities. We want to also check to make sure that the patient's personal health information is protected. You might need to have a formal contract, especially of course, with the vendor to make sure that patient information is never given to another party. Okay, so all patient information must be kept private and for the medical use only, except to be used by the doctor. So such contract needs to be in place. And one of the things we want to be able to do is to be able to make sure that staff and patients should be able to schedule visits on the platform. A patient needs to see a doctor, they should be able to they should be able to call in or go to a website or go to enter one of the platforms of the EMR and be able to schedule a visit. So such functionalities must be present in any telehealth vendor that's trying to offer you a service. Then, of course, the ability for a patient to give consent to receive telehealth services on that platform should be um, should be should be incorporated. So there might be a form on the telehealth page that says that I accept to receive services online via the telemedicine. Okay, so we also want to know sometimes some telehealth vendors also have mobile apps which patients can also use, or sometimes you also need to consider how will this patient connect. Is the patient going to connect only with a video app or with an audio call? So, and lastly, we want to consider, is this consultation encrypted or is it safe? Can somebody hack into it? Can anybody else connect to it? So it's good for a doctor and patient to know that their communications and whatever they are divulging is between the two of them, and no third party can eavesdrop on the conversation. Now, for the purpose of COVID-19, emergency rules have been set up all over the world to allow and encourage the use of telemedicine and telehealth services. And one of such emergency rules, especially in places like the US and the UK, I'm sure most of Africa tries to, is that you can use the commonly available video chats as for the purposes of consultation. Of course, post COVID-19 emergency periods, this might not be, but some of the ones that they can use at present include FaceTime. You can call a patient on FaceTime. A patient can stay anywhere and call on FaceTime and discuss their medical problems with you, and it's taken as a consultation. That is, you have consulted this patient and you can prescribe the treatment. You can order lab tests that the patient can go and revert back to you either online or through any other agreed means, and that's a consultation. Video chats from Facebook, Google Hangouts, Zoom, like we're currently doing, Skype presentations, and Skype consultations are also possible. So you can use any of these, especially in the period of COVID-19 emergency, to quickly see your patients, transcribe the visits on paper or on your EMR, and such a visit counts. Okay, then there are some other platforms that are more HIPAA compliant. You ask me what is HIPAA? HIPAA is basically the healthcare insurance providers association that's come up with some rules, especially in the US, whereby patient privacy is protected. Okay, so these platforms are HIPAA compliant. Patient privacy has been built in, and all the information that's needed for medical practice has also been built in. So it's more healthcare friendly. We have Zoom for healthcare. We have Updocs, we have Skype for business, we have Microsoft Teams, which is more for built for medicine, VC, Cisco WebEx meetings. All these other platforms, these platforms I've mentioned here, are HIPAA compliant, they are medical compliance, they are more in compliance with laws governing the practice of medicine. But as of today, any video conferencing modality or app that is safe, that can be hacked into, can be used, especially in this period of COVID times, for consultations. But post COVID, we are going to be more likely to be restricted to the ones that are healthcare compliant, that ensures and verify that patient safety is not compromised. So these are some of the platforms. Locally, we have so many of them. We have our EMRs, we already have inbuilt video conferencing modalities in them. So those ones are already there. So whatever you have, you can use them. You don't have to use the highfalutin EMRs to do such thing right now. What you already have is already sufficient. Your phone, your mobile apps, and all those ones are already there for you to use to start. You can always upscale as things go forward. Um, so telehealth implementation. So for you to be able to successfully have a telehealth or a telemedicine platform, there are some things that needs to be in place. One, you must be able to establish of course, your telemedicine means that you still have your patients who are coming in physically, and at the same time, you also have people who are consulting and getting treatments via the telehealth platform. Now, for you to be able to successfully combine both, you must be able to have a different, a well-established telehealth implementation guide and workflow. This is one of the things you should consider if you're having such a workflow. One, the time available for telehealth. If you have enough staff and you can take in telehealth at all times, maybe that's possible. But for most people, they need to have a specified times and maybe specified periods when patients or specified appointments for telehealth services. So you need to be able to identify what times. If I run clinics 10 hours a day, I might say that the first 2 hours or the middle 2 hours, whatever time is for telehealth, the other one should be for physical appointments. It depends on how big the practice is or how big the hospital is. And what services are you going to provide via the telehealth medicine? Some people have said, oh, all dermatology appointments can be online, all endocrinology appointments can be online, all all GP consultations start with online. If you think it's not, you need to come in for a visit, we'll ask you to come in for a visit. So you must be able to know what services you are going to provide via the telehealth platforms. Of course, you need to get your patients to be aware and to get consent from them. A verbal consent is mostly appropriate, but then you can also have a written consent or a consent on your EMR. Then you're also going to decide how you're going to undertake or perform your laboratory and investigations. So laboratory and radiology services, patients can easily have their consults via the telemedicine platforms and be directed to come strictly for blood tests or radiology services only. So after the consultation and they need to run one or two tests, they're directed to come to the hospital or to any of the diagnostic centers uh, to have their labs and their blood supplied or taken for such tests. In some cases, such tests can actually be taken from them from their home if they are willing to pay for such services. So I know some practices that actually send their lab scientists in patients' homes to pick up one or two samples if the patients are willing to pay for such services, and then of course have the results ready and discuss over the phone and the medications and all this. So the not only source the medication supply, so you must also outline how the medications are going to be supplied. Is it a drug process? After the consultation, the prescription has been made, the hospital has made ready the medications. The patients can simply come to the hospital while in the comfort of their cars. Their medications can just be delivered to them. That's one. You can also use all these delivery agents the whole places. So a delivery agent can pick up the medications from the hospital and deliver straight to the patient's home. That's another method. We also have the HMOs sometimes who can come. Oh, we have consulted with such patients. Our patient requires this and this medication. The HMO offers to supply and deliver the medication straight to the patient's home. So there are many ways medications can be delivered. So you decide what modality you are going to operate with. The patient can come to your hospital and pick up the medications, or the other ways we can be done. But anyway, the whole idea of this is to make sure that patients' visit to the hospitals or contact is minimized to the barest minimum, so to speak. Now, payment modality. All telehealth medicines must be paid for. We are using the doctor's time, and in sometimes more time might be utilized using telehealth medicine. So doctors needs to pay. So we must know how we are going to get paid. If it's an HMO patient, the patient maybe HMO has already agreed on the payment modalities and all those ones. So payment modality is quite important in implementing the telehealth practice. So tech supports, you need to have technologists, IT people around, either in your facility or online, or also or through your providers, your tech providers. And so you have to talk to patients, of course, about these services and train your staff about the services as well. So conducting a health service. So as a doctor, I want to start consulting a patient. So what are the things I must do? One, you must try to use a private room or a private consulting room. As much as possible, privacy is critical in medicine, in medical practice. For new patients, you have to introduce yourself, confirm the patient's identity. It's critical you confirm your patient's identity. Some people, if you're already familiar with the patient, excellent. If it's a new patient, they're not even aware. Sometimes you might just need to confirm the patient's identity, whether the patient has pre-registered and they have his picture there, or you can use any of the government's identity methods to be able to identify a patient. Whatever ways, it's always good to introduce yourself and make sure that your patient's identity is properly confirmed: age, name, sex, and maybe date of birth. You have to discuss there. You have to go there. You go into the purpose of the visit, consult with the patient, obtain consent that your consultation and everything is going to be online and that's acceptable to you, then that's fine. Then determine, as I said, the consent doesn't have to be written. Verbal consent is okay. And then sometimes if you have an EMR that has a consent form, patient can also sign that. But obtain consent, verbal, written consent is needed. Determine who is in the room with the patient. So sometimes on the other side, you have made sure that you are in the private consulting room. The patient on the other side also needs to be private. You don't want to be consulting a whole family at the same time. So determine that the patient is there. How many people are there with him? If it's one or two and you're okay with that, then that's fine. If it's more than one or two and you're not okay with them, ask the patient to stay in a private place, because some of the questions you might be asking the patient to give you might be confidential. And if there are so many people there, the patient might not actually be telling you the correct things. So you want to be sure that the patient is also in a private room, or at least is in a place where he or she is comfortable to be able to give you the necessary information you need. Okay. So of course, thereafter, of course, obtains the patient's health history, and you want to maintain the same standard as the normal clinic visits. Ask all your questions you want to ask. Obtain as much clinical data as possible. If they have pictures of their conditions, if they've done if they have a digital device at home, they've done their BP recording, they've done your pulse recording, they have their temperatures, get it from them. Know as much as possible, get all the clinical data you can get as much as possible. Then, of course, you'll be able to arrive at a possible strategy, I mean, clinical plan. Okay, I need to do these investigations, I need to offer this treatment, or I need to do these referrals. So, after you've done this, after you've, of course, consulted with the patient, the next thing is to draw up a plan of care and explain the plan of care to the patient, and write this down in your own clinical notes, either your EMR or paper and pen or your patient's case file. Patient has been seen, these are the complaints, this is the diagnosis, these are the investigations patient has been referred to, these are the medications being applied. Patient is also referred to see this patient or to see this doctor. All those needs to be properly outlined in the patient's case notes, either in the paper form or in the electronic forms. Okay, if there are need for further visits, medications, and testing, must be as protocols. You can also connect patients to online resources, especially if they require more information or more ongoing education about their clinical conditions. So, billing for telehealth. Billing for telehealth is a particularly important part because you must be compensated for the services you provide. So it depends on the type of patient and insurance type. For private patients, of course, it's clear. The patients pay their consultations as per your hospital, and then that's fine. As per insurance basis, telehealth is being recognized as a normal doctor-patient consultation worldwide. In the US, Medicaid and the Department of Health Services reimburses doctors' consultations online or via phone. But they have some caveats, like they might say, okay, I consult you via phone no more than once a week. So after the first phone call, they pay you full consultation for the rest of that week. Any other phone consultations will just be seen as an addendum to the first initial consultation. All depends on how it is worked out. between the various parties. Okay, as I said, there could be as any clinic visit. Sometimes there could be home visits. So if there are home visits, all depends on pre-agreed prices and protocols. This must be billed. If it's from an insurance patient, insurance, as I said, and state and government and everybody is beginning to pay for home visits or home services. And okay, this ones might cost more reasonably, and therefore might need to be charged more. If I have to leave the comfort of my hospital to go and take samples from a patient at home, then transportation needs to be factored in, and of course, extra time because you're using more logistics for such processes. So all those ones needs to be factored in. And of course, if the patient chooses to drive to the hospital and get the samples taken and having all the tests done, then that's also important. So the billing is also depending on how the telemedicine and telehealth service has been configured, and also dependent on the various parties, the HMOs, the patients, of course, and the caregivers and the doctors. Okay, so a healthy system or a healthy billing system that takes note of all the practices is important. The legal aspects of telehealth, I'm not going to delve much into that, but most time, as of today, there is this emergency laws that allow us to be able to practice like like you have practiced in your office. You can do that online. That's just the difference. So the whole laws are still the same. The same way I would treat somebody with hypertension, whether it comes to my office or it calls me over the phone, it's still the same way. Nothing should change. So the same services I give to somebody I think has malaria, whether it calls in or I get the lab test from a different lab and I know what the treatment is, it's still the same treatment. So the standard does not change. What has changed is that the patient does not need to come to the hospital, and he can reach out to this patient via telehealth medicine. So the laws are still basically the same, except that now that the law allows us to be able to consult via telehealth. And key part of telehealth medicine is remote patient monitoring. Some of the fastest developments in medicine is taking place in patient monitoring remotely. And I'll be able to discuss this quickly. Some of the devices and modalities have always been there, but they've come into greater use with the advent of COVID-19 and the increased use of telehealth practices. One, of course, BP, we have mobiles and home use, speaks, patients can use. We have pulse oximeters, patients can monitor their oxygen saturations at home. COVID, the national COVID treatment, state COVID treatments, sometimes for people that have been not so ill, they've been basically telehealth medicine. Patients are consulted over the phone and told what to do, and then they do that and they get well. So telehealth medicine has been used by the state government, by the federal government, by everybody, and it's come to stay with us. Okay, glucose meters for diabetics. So diabetics can have glucose meters, and they can have pulse oximeters, they can have mobile speeds, and all these are constantly, the values can be reviewed by the doctors during a telehealth visit and appropriate the clinical decisions made. Cardiac pacemakers, these ones have always been with us, but they've improved in recent times. In recent times, you have pacemakers that are automatically connected to patients' phones and transmitted remotely to the hospitals where they are monitored in real time. If there's a problem, because daytime, every day, so a technician goes and reviews the parameters. If there are any flags, any problems, patient is notified and appropriate interventions made. Many more devices are coming on board in the cardiology sections, but these ones are critical and they're important to enable
recording in progress
to make sure that patients' devices are patient vitals and clinical status are quite monitored. Before I finish, I would like to talk about mHealth. mHealth refers to use of mobile data, mobile devices, and third-party apps for the collection of patient data. So people have Fitbits, people have phone apps that can do ECGs, maybe 1 lead or 2 lead ECGs. Okay, they also have apps that are trying to be able to do blood pressures, that are trying to be able to monitor the oxygen saturations, and some of these apps can integrate directly into electronic medical records or electrical health records platforms, whereby the doctors can monitor it at intervals or in real time. So all these ones are really transcribing, and it's fast. It's fast coming online. There are lots of changes that are happening within the last 1 year, and more are come. 5G platforms are there, and for remote medicines and extending the reach of healthcare. We have had cases where a neurosurgeon has clearly said, I'm here in the United States and they're doing a surgery, excuse me, and they're doing a surgery in Malaysia. And because I can connect with them in real time, the neurosurgeon is seeing via videos and cameras how the surgery is progressing, and it can give advice. And in some cases, with 5G platforms, it can even control remotely some surgical knives and precision lasers. So we have a case whereby a doctor can be remotely placed and participates in a care service for a patient. Okay, so and such platforms are only getting better and getting more refined. So telemedicine guided care and surgeries have come to stay with us. Telemedicine, even in remote areas, most remote areas, even in Nigeria, will have access to a phone call, okay, and possibly a video messaging app. So patients who are in the villages or in remote areas can still have access to specialist input into their care using telehealth platforms. So that's the really advantage of all this. So many EMRs these days are extending to phone apps. So patients can have a phone app of your hospital EMR using the patient interface. There you can use to book their online. You can use to book their online, schedule appointments online. There they can record their blood pressures, they can record their pulse, they can record their temperatures for monitoring, depending on what you're treating the patient for. And if you think things are going out of line, you can invite the patient to come straight into the hospital. And if things are fine, the patient is doing well, of course, you cheer the patient up. So these are all some of the modalities that happened. So in summary, post-COVID, of course, during COVID and post-COVID, the healthcare and workplace have changed. Patients are demanding less visits. They prefer as much as possible to be able to stay in the comfort of their offices or homes and get the immediate healthcare they can when it is possible. It's not always possible, but when that's possible, of course, that should be the preferred choice. Of course, there's need to adapt and continue with the global trends and changes. People are, as I said, are having to transport themselves less to the hospitals, and when they can speak with the doctors online, get their prescriptions delivered to them, and life goes on. So telehealth has come to stay. Infection control measures have also come to stay. So the infection control systems that have been adopted for COVID are still important going forward to prevent any other outbreak of infections. Okay, so prevention of COVID, of course, vaccination is essential, and COVID as an illness has come to stay. COVID might not be completely eradicated, not in the next 1 or 2 years, or like smallpox or some other ones. But then, while COVID is still here with us, we continue to take vaccination seriously, and we continue to take the important protocols very seriously. So COVID has brought in its wake some good progress to medicine via telehealth services. So please, let's key into this, make our practices more responsive and efficient, and as well as make it more safer for the workers in its place. Thank you for listening. So any questions, I'll be glad to take any questions before I leave.
Thank you very much, Dr. Osim. We give Dr. Osim a virtual round of applause wherever we are. The presentation was insightful, was helpful. Thank you. Was insightful, was helpful to, and a very instructive material in getting started with telemedicine, the multifaceted innovation and solution towards 21st century healthcare. Thank you very much for that again, Dr. Usim. So if you have questions, if you have um, comments you want Dr. Usim to respond to or to attend to, please do well to drop them in the comment section so we can take them very quickly. We have um, Dr. Usim is still here with us and is ready to take the questions and the comments. So please do well to drop them. And we are here to help you amplify them to him. Um, we still have other presentations and other insightful engagements lined up for us. But we would like to spend our time with Dr. Usim very well. So once again, if you didn't get me here earlier, if you have questions or comments for Dr. Usim, please drop them in the comment section so that he can attend to them. Waiting for questions. We're still waiting for questions. An insightful presentation like this should trigger something in us to make us ask for some more clarifications from experts who are in the house. Remember, we don't get to have the opportunity to converge every time like this, and it's time to make quality use of this moment together. Even if you don't have questions, if you have contributions towards the discussion, please do well to drop them. We're going to give the next few minutes just to harvest our comments and contributions or questions.
Can be assured that healthcare can be easy. Whatever life throws at you, you shouldn't have to bother about your HMO. The reason is obvious. We're committed to you. We put you first. We feel what you feel. We walk the talk. We show up through the good and bad times. You can count on THC as your reliable partner. Strong and kind, resilient and responsible, experienced yet modern. Our purpose is simple. We're here to make you healthier.
What strategies do you advise for healthcare providers to offer improved services as well as stay safe? I take
You said the
the
question
question
again.
Everyone wants the best
that
things
we
out
are
of life.
okay.
The best friend,
Now that we
Sorry,
are seeing
the
there's
best
a background
partner.
music going on.
oh,
Okay, good. Yeah, good.
okay, we're good now. All right, thank you, doctor. Now it reads thus. It says, now that we are seeing the third wave of COVID-19, what strategies do you advise for healthcare providers to offer services as well as stay safe? What advice do you have for healthcare providers to offer improved services as well as stay safe?
Okay, thank you
That's
very
the
much.
question.
I'll just proceed with that question immediately. Okay, with the third wave going on, so there are number of things to do. One is, as much as possible, patients can call before coming to the hospital. That's one. That means to say a patient is coming to the hospital and says, I want to come and see a general practitioner. And if they can call for that, and I will ask them simple questions. Do you have a fever? Do you have this? Do you have that? If I think it's COVID related, I can tell them, oh, go get the COVID testing done before you come. Or I tell them, come to the hospital, but I will take the adequate precautions. Those are not, those that can be done online. Okay, that's the telehealth aspect of it. Okay, patients coming because they want to check their glucose, or they have a skin problem, or they have backache and all those ones, which I think is something we could handle online. Then I will tell them, okay, can we do a phone or video consultation? And the patient accepts, that's a consent, that's accepted to a telehealth consultation. If you accept that telehealth consultation, then I can do a video or phone call consultation. If I think he needs to do one or two more tests, I offer those tests to be done, and I'll tell them where exactly we want them to be done. Some of them might need to come straight into the hospital and get that done there. Otherwise, they might need to go to a nearby diagnostic center and get those tests done. I review those tests, I call the patient back, and give him the appropriate prescription or medications. So, and that's the way it goes. So in that way, I'm screening one, I'm letting less people come to the hospital. I'm still doing if I were built to see like 20 patients a day, and they can call ahead of time. Of course, if you have an appointment system, then I can know that out of that 20, 10 can be consulted online, 10 still need to come to the hospital. The 10 that come to the hospital, I know what precautions to take for them, and I know what kind of complaints they have. This might not always be possible because we also have emergencies and co. But those ones, as they come, you do the appropriate things, you screen them, and you know what they're coming. Of course, you treat them if you can, and of course, if you need to refer them, you refer them. So, but by utilizing telehealth medicine, less people are going to come to your practice physically. So more will be seen virtually. It's the same consultation fees you get. So at the end of the day, the patient is safer and you are safer. And if the patient needs to run some tests, the opportunity is there. The patient can either come to the hospital and simply go straight to the lab. So the patient spends less time in the hospital facility, or goes to a nearby health diagnostic center and gets the test done. And that's also the same. So in this third wave, you want to minimize patient contact as much as possible. You also want to avoid patients coming to the hospital less. Okay? That way, social distancing is a way it's better practiced. Patients are less at risk, and you yourself and your staff are less at risk from having less contact with people that possibly have COVID. So that will be my advice for you to consult with your patients in this third wave of COVID. And not just this third wave of COVID, but even post-COVID, as much as possible and where possible, instead of having clinic visits, where possible, do telehealth consultations. Thank you.
Thank you very much, Dr. Usim. That was very helpful, and I hope that spoke very well to the person who asked the question. We have another question, and this one is coming right from the studio here. The person asks that with telemedicine, right, as a digital-based solution, it would appeal and be easy to understand by the educated or the literate or the learned. How does telemedicine penetrate, or how can it reach effectively those who are uneducated or learned or in the interior parts of the country? How can telemedicine solutions be deployed or reach them in a very effective and sustainable
Okay, so thank
manner?
you again for a good question. I tried to talk about that in my presentation. Well, let me just quickly say this. Okay, just a minute. I'll quickly say this. For people in the rural areas, so there are some rural areas one, then unlearned. These are the two keywords there. Unlearned people. Okay, so two keywords, very important. So I'll prefer to address rural areas. So people in the rural areas, there's hardly any village or city in Nigeria that doesn't have access to phone service. Phone. So that means people in the rural areas can still be reached via phone. Okay. So what does that mean? Somebody has a back pain in the rural area. I can do the basic consultations on the phone. If I think this patient needs to have investigations done, then I refer him to the nearest city to him where he can have those investigations done instead of coming all the way to Lagos or Abuja. Okay, so somebody is in Baga somewhere, and he can go quickly to Jos or somewhere, or instead of going all the way to Abuja or going all the way to Lagos, they can have those investigations done there, and then of course get those. As I said, once there's a phone service and an internet service, then you already have telehealth reaching there. We are not going to be the ones that are going to rewire the nation. We can't do that, but we're going to take advantage of the existing platforms, okay? The phone networks, of course, the internet facilities around to be able to penetrate. Where such is not acceptable, we just have to wait till the technology penetrates that area. That's the best we can do for the rural areas. We might not be able to take all the high-tech stuff over there, but once there's a phone service or internet service, then telemedicine is definitely possible in that kind of setting. Then for unlearned people, language, everybody speaks a language. So unlearned people have their language. So in every village, there's somebody that can at least speak English or interpret their language to them. I have pain. I have pain. So in their own local language, they can tell you they have pain. So if they have pain in the chest, or they have pain in the head, or they have pain in their legs, or they can't urinate, or they can't do that, they can say that in their own local language. Somebody will just have to interpret. And this can be easily done via phone. In fact, it's easier for you to get an interpreter near the patient than to come to hospital and be able to communicate. So in the patient's home, there'll be someone they know that can speak their own language and at the same time speak English. So in that village, they know, oh, Mr. Sampson can speak our language and speak English. So if I want to speak with the doctor over the phone, I will call Mr. Sampson. I will tell Mr. Sampson what the problem is, and Mr. Sampson will tell the doctor in English what the problem is. So an interpreter is all that's needed to have that telemedicine function. And I'm saying that telemedicine is already more efficient than even coming to the hospital itself in this regard, because in the hospital, you might not necessarily have an interpreter, but if they're at home and they have access to interpreters, then you're all good. You can get the communications going, you can get the conversation going, and the conversation keeps on going. You find out what the problems are, and you outline a treatment plan. Once you can get a treatment plan and it's executed, the patients will have adequate health care. Thank you.
Very awesome answer. Can we give Dr. Hussein a big applause there? Two key things we could extract from your response there, Dr. Hussein, is to leverage available network irrespective of the corner in Nigeria, and to also leverage
Oh yeah. Stop.
Hello.
You can hear him, but you can't hear him. You can hear him.
All right.
Just continue. You can yes. Let him address those on Zoom. That we have our next YouTube. 15th. Yeah. Those you can drop in next week.
Hello, everyone. Please spare us a few minutes. We have a little glitch here. We will be back online very shortly. We just have a small glitch. We will be back in a few seconds. Please stay tuned while our technicians get this
Yes,
sorted out.
please.
Thank you.
Okay, that's fine. That's
Dr.
fine.
Usim, please stay with us. The questions will be taken and addressed as soon as we're back online. In the next few seconds, we will be back online. Thank you. Okay, thank you very much for staying with us. We've resolved the glitch here in the studio and we're back online right now. So, while we were away, we were just trying to share the recap of the very insightful points that Dr. Usim shared with us. And the question that was being answered was the question on how to penetrate the unlearned and the rural areas or the interior areas of Nigeria with telemedicine as a digital solution, leveraging digital in the age of these people. It's not only those in the cities or in the urban areas that need to access these medical services. And so, I was just about to highlight two very important points from Dr. Usim's response on that question. And those important points were leveraging network wherever it is in Nigeria. And you will all agree with me that irrespective of the interior areas of Nigeria, still some form of network reception there. And then he also mentioned language. We all agree that Nigeria is a nation with a whole lot of language type. We have about 350 languages in Nigeria. So you know, irrespective of wherever we are, as healthcare providers, we can help to spread the word on telemedicine and ensure that it actually penetrates all of this area. Thank you very much, Dr. Wilson, for that. We have to help us with before we let you go. I hope you can answer that for us. One of the questions is how healthcare providers can assess. Hello, 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 hello. Please confirm that you can hear me in the comment section. Confirm that you can hear me in the comment section, please. Dr. Usim, can you hear me?
Yeah, I can hear you very well. Thank you.
It's uncertain about what was going on. We had a bit of. We've just rectified that and we're back online fully right now. So just before we went offline, I was trying to extract some key talking points from the response Dr. Usim gave to the question, and we he was responding to the question of how to penetrate rural areas and the unlearned with telemedicine solution or telehealth being a digital solution. Two key points that he shared as to how to go about that was to leverage network strength no matter how small it is. And we all know that, yes, no matter how interior the area is, some form of mobile services is available there. And to also leverage our language diversity and strength, right? Even in its multiplicity, it's a strength to us as a nation. So once we can have us as providers and even we as health insurance come together and iron out how we can continue to drive medical services through this leveraging platforms, we will be able to share this news of tele and how it can also improve healthcare at the interior areas. Two more questions, Dr. Usim, just before you go.
Okay.
One of the questions says, how can providers access telehealth solutions? How can they onboard telehealth solutions or acquire them, as it were? Will you advise providers to go about onboarding it as part of their provisions or services in this digital age?
Okay. Let me answer that question immediately. So one, as I outlined in my lecture, I said one, the first step is to be able to select a telehealth digital partner or solutions provider. So in Nigeria, there are too many of them and they're competing with themselves. Okay. I don't want to market any particular provider, so I wouldn't mention names, but they are all there. Okay. If you say you want a telehealth or an EMR, so most EMRs these days are, because of COVID, also having video conferencing and video consultations present. Okay, so consult with the various EMR providers across the country. Many of them even provide mobile services, mobile solutions in your hospital's name. So that means to say that my hospital name is Nigeria. Okay, so you have Nigeria Hospital as a mobile app on the patient's phone. So there, the patient can input, but let me not go back to the lecture again. So, but now, so how can you assess that? So, my kind of advice is get 3, 4, 5 EMR providers, okay, and find out which ones meet the criteria I set out before. One, they must be able to give us security, that there's a privacy. Two, they must be able to provide basic things like consent, and then of course the video or the telephone conversations, and being able to record or whatever it is. And that's one. So that's the EMR option. The other option, okay, especially in these emergency times, as I said earlier, is as long as you have a phone, okay, then you have telemedicine with you. Okay, so you have a video visit. You can have a video visit if you have the necessary Skype. You can use Skype. You can use this. So after a video visit, you've discussed with the patient. You've extracted your history. You can decide to put down your history on paper. You can decide to put down your history on an electronic medical software. So you have had your history. Then any other things you can extract, either a video. If the person sent you a video on WhatsApp, you can print it out and put in the file. Otherwise, you can put that directly into your EMR. You can send this patient for tests. Either it comes to your hospital for the test, or it goes to a nearby diagnostic center and runs those tests. You put those ones in. At the end of the day, you have a plan. You have your history, you have your all of that data there, you have the investigation. So the only one that is not fully done right now is a physical exam. And if you feel you need to do a physical exam, then you have to ask the patient, sorry, this consultation will not be complete until you come for a physical examination. And what we're trying to say is that there are many cases that don't require a physical exam for you to arrive at a diagnosis, especially if you have done all those tests. But those ones you feel that needs to have a physical exam, like somebody presenting with an abdominal pain, then the patient must come to hospital to have a physical exam and before any further investigations can be done. So, but the whole idea is by the time you utilize telehealth medicine, you're able to solve many people's problem online So only a fewer patients need to come to the hospital for further investigations and evaluations. So please, to assess healthcare solutions, please, the first step is to choose an EMR if you can, and if you can't, you leverage on the existing platforms to create a workflow, as we have already discussed. Okay, I decide to use WhatsApp video. Okay, I decide to use WhatsApp for now. I use WhatsApp video and I use WhatsApp chat. Okay, so I use WhatsApp video to see this patient and discuss and get all my history down. I use WhatsApp chats to get all the other data, maybe test results and everything else. I put them on the file and I send this patient their treatment or whatever it is, and I schedule a follow-up. That's accepted. That's accepted. So it depends on what you have and what you can afford and how big your practice is. So for very big practices, you can use very expensive EMR solutions. For very basic practices, I mean, for now, WhatsApp or some of the existing social media or video conferencing facilities will just suffice. I hope this answers your questions. Thank you.
Thank you very much, Dr. Osem. That was very helpful. Two key points I could extract from that was that we need to have a workflow as providers. So it's not just about the solution that you onboard. Your workflow is ultimately very important. And then your data management process, how you manage the data that you collate or that you gather, is also as important as your workflow. Thank you very much for that. And for the last question, here, Dr. Osem, last question
Okay,
was
good.
for, all right, for your session. Please let me read that out as we bring your session to a close. In a situation whereby a patient refuses to come for a prescribed drug and request for the name so has to go to get them from a pharmacy themselves, what do you do? This also applies to lab tests, and you know the hospital needs to make some profit at least from these services. Did you get the question, sir?
I got the question very well. So
right.
medications, I'll be very straightforward with this, okay? And I would say the best practice is what we advocate for, okay? It's simple. The patient, you need this patient to run some tests, okay? And you prescribe those tests. You can tell this patient, come to the hospital and just have your blood taken for this test. I get it. If the patient is insisting that your hospital is too far from them and all these ones, then I'll just give you a personal note. I always believe that even if you give this patient those test results and they go and do it elsewhere, it doesn't take much away from you, okay? Because you're not going to make your best. Of course, you make some money from the test, lab test result, but it's not going to take so much away from you. So, likewise, the medications, you can write a prescription for this patient to go somewhere else, okay? At the same time, this patient is being safe, and you yourself are also being safe in this COVID period. At the end of the day, I always say that things balance out. Patients have an increased confidence, trust in the hospital, which in the final run will bring them far more profits than getting the patient upset with refusing to allow him run the tests at nearby facilities or gets its medication from nearby pharmacies. So I don't see anything really wrong, okay, in you yielding to patients, especially in this COVID period, to have their medications picked up from a pharmacy nearby. Obviously, if it's up to a patient is insisting on that might be because of distance. But if not, you can always convince the patient that, look, you stock the better medications, you can better verify the medications you stock, and as such, you need to come here to just pick up the medications and with nothing else to be done. So it all depends on how you can reach a compromise with your patient. But either side is valid. So either side of saying that the patient can go somewhere else around the test is valid, or the patient must come to the hospital to pick up the test and the medications is also valid. But as I said, at the end of the day, whatever you can compromise, you can reach with your patients, the better it is. But it's best for you to carry your patients along, and so you can have increased confidence in your services and of course in your treatment. how the treatment be. I hope that answers the question.
Thank you very
Thank
much.
you.
That brings this session to a close. Dr. Hussein, we are extremely grateful. Thank you for your
Yeah.
time. Thank you for taking time out to answer those questions. And more
Mm.
importantly, thank you for making them very explanatory as key points for every one of us to go on to act on. We're grateful for this and we appreciate you once
Okay.
again.
Thank you so much for
Very
having
much.
me. I appreciate it. All right.
Yeah. To the rest of the friends, we continue in today's session. Please stay tuned as our moderators continue to usher us into other agenda for the day. Thank you.
Thank you, Femi. Thank you, everyone, for still staying with us. That was such an insightful session by Dr. Usim. Dr. Usim walked us through the adoption of telemedicine, and you agree with me that telemedicine is not the future. Telemedicine is the now. Not just in our country, but everywhere in the world, telemedicine is the now. So we hope that with this session, you've learned not just how to start, but how to sustain your telemedicine practice. So we'll be taking some brand materials now, as well as sharing some of those goodies that we promised at the beginning. So please don't go anywhere. Stay with us, and we'll be right back.
It's the best things out of life. The best friend, the best partner. At Total Health Trust, we understand partnership. Like friendship, it's about giving and commitment. There is nothing better than having a great partner with a great purpose. Purpose fuels, purpose drives, purpose enables. At THT, we move and breed our purpose, working together to make Nigeria healthier. We cannot promise that life won't be tough, but you can be assured that healthcare can be easy. Whatever life throws at you, you shouldn't have to bother about your HMO. The reason is obvious. We're committed to you. We put you first. We feel what you feel. We walk the talk and show up through the good and bad times. You can count on THT as your reliable partner. Strong and kind, resilient and responsible, experienced yet modern. Our purpose is simple. We're here to make you healthier. Everyone wants the best things out of life. The best friend, the best partner. At Total Health Trust, we understand partnership. Like friendship, it's about giving and commitment. There is nothing better than having a great partner with a great purpose. Purpose fuels, purpose drives, purpose enables. At THT, we move and breed our purpose, working together to make Nigeria healthier. We cannot promise that life won't be tough, but you can be assured that healthcare can be easy. Whatever life throws at you, you shouldn't have to bother about your HMO. The reason is obvious. We're committed to you. We put you first. We feel what you feel. We walk the talk and show up through the good and bad times. You can count on THT as your reliable partner. Strong and kind, resilient and responsible, experienced yet modern. Our purpose is simple. We're here to make you healthier. Everyone wants the best things out of life. The best friend, the best partner. At Total Health Trust, we understand partnership. Like friendship, it's about giving and commitment. There is nothing better than having a great partner with a great purpose. Purpose fuels, purpose drives, purpose enables. At THT, we move and breed our purpose, working together to make Nigeria healthier. We cannot promise that healthcare can be. Whatever life throws at you, you shouldn't have to bother about your HMO. The reason is obvious. We're committed to you. We put you first. We feel what you feel. We walk the talk and show up through the good and bad times. You can count on THT as your reliable partner. Strong and kind, resilient and responsible, experienced yet modern. Our purpose is simple. We're here to make you healthier. Everyone wants the best things out of life. The best friend, the best partner. At Total Health Trust, we understand partnership. Like friendship, it's about giving and commitment. There is nothing better than having a great partner with a great purpose. Purpose fuels, purpose drives, purpose enables. At THT, we move and breed our purpose, working together to make Nigeria healthier. We cannot promise that life won't be tough, but you can be assured that healthcare can be easy. Whatever life throws at you, you shouldn't have to bother about your HMO. The reason is obvious. We're committed to you. We put you first. We feel what you feel. We walk the talk and show up through the good and bad times. You can count on THT as your reliable partner. Strong and kind, resilient and responsible, experienced yet modern. Our purpose is simple. We're here to make you healthier.
I have dreams for my future and my family. I dream about building my own business. I dream about traveling the world. I dream about watching my children growing up and celebrating important milestones with them. I dream of growing old, content with my spouse. I dream about seeing my grandchildren take their first steps. But life is uncertain, and the health of our loved ones is our only true wealth. What if my child got very ill? What if my spouse needs surgery? What if we had a serious accident? What if we had a challenging pregnancy? Medical cover is so complicated. I'm not sure I would know what medical treatment we could get, from whom, and what it would cost. I wish I could have peace of mind that I can access the care we may need now and in the future. I wish medical cover was easier to understand and easier to access. At Liberty Health, we understand that worry is a thief of joy, which is why, in your country and across Africa, hundreds of thousands of people have accessible, affordable, and understandable medical care. They can enjoy the present and have the peace of mind that if something bad happens to them or their family's health, they are covered. From taking care of your everyday health to serious conditions and emergencies, with us, you are covered. Whatever benefit plan you're on, so you can focus on cherishing every moment with your family. Liberty Health, working together to make Africa healthier. I have dreams for my future and my family. I dream about building my own business. I dream about traveling the world. I dream about watching my children growing up and celebrating important milestones with them. I dream of growing old, content with my spouse. I dream about seeing my grandchildren take their first steps. But life is uncertain, and the health of our loved ones is our only true wealth. What if my child got very ill? What if my spouse needs surgery? What if we had a serious accident? What if we had a challenging pregnancy? Medical cover is so complicated. I'm not sure I would know what medical treatment we could get, from whom, and what it would cost. I wish I could have peace of mind
that I can access the care we may need now and in the future. I wish medical cover was easier to understand and easier to access. At Liberty Health, we understand that worry is a thief of joy, which is why in your country and across Africa, hundreds of thousands of people have accessible, affordable, and understandable medical care. They can enjoy the present and have the peace of mind that if something bad happens to them or their family's health, they are covered. From taking care of your everyday health to serious conditions and emergencies, with us, you are covered. Whatever benefit plan you're on, so you can focus on cherishing every moment with your family. Liberty Health, working together to make Africa healthier.
All right. There you have it. Total Health Trust, a member of Liberty, working together to make Africa healthier. And we here in Nigeria, of course, we're working together with you, our providers, to make Nigeria healthier. And our providers, esteemed providers here in the northern region, we're working together with you to make Abuja, Kano, Kaduna, Niger, every state, Sokoto, everywhere in the north, healthier. Yes, it might just look like a fast, but it's something that is possible as long as we're working together with you. And just about now, we're going to be entering the first phase of our freebies. We're going to the first phase of our freebies. And to get prepared for those freebies, please pull out your phones from your pockets. Pull out your phones from your pockets. And I want you to snap your fingers ready to punch in some digits. We have airtime available for all the major networks in Nigeria, and that includes MTN, Glo, Airtel, and Etisalat. I believe that about 95% of us should be using one or multiple of those networks. So if you're fast enough, you should have a sizable chunk of airtime on your phone within the next few seconds. All right? So I believe that we're ready. If you're ready, please type in the comment section that I am ready or good to go. If you're good to go, please type in the comment section, ready or good to go. If you're ready, let's keep those comments coming. All right, so here we are. I can see that we're ready. I can see a lot of ready, good to go. Yes, so that means that your thumb is ready to punch the numbers very, very quickly. I'm going to do a countdown from here, from 5 down to 1. Last, in the session yesterday, the first episode of the forum, in the session yesterday, we had people win very big chunks of airtime because their fingers were very, very fast. We're not going to mention names of providers, but we hope in the northern region today we can have very interesting numbers accrue to one provider or the rest. I mean, it's a beautiful thing to have your phone loaded with enough airtime for you to do whatever you want. So I'm going to count down from 5 here, and at the count of 0, your screen is going to pop up with 4 airtime numbers, with the numbers for 4 networks: MTN, Airtel, Glo, and Etisalat. Are you ready? Are you ready? I start now. 5, 4, 3, 2, 1, 0. There you go. Fastest fingers first. Fastest fingers first. Fastest fingers first. If you've been able to load it, just put it in the comment section. If you've loaded it, please let us know. If you've loaded it, please drop in the comment section that you've loaded it. If you've loaded it, please drop in the comment section that you've loaded it. We have more than enough to go around for everyone. And a next set of airtime numbers are popping up very soon. If you've loaded it, please drop in the comment section. El Rafa, congratulations. We understand that you've loaded one successfully. Congratulations to El Rafa Clinic. El Rafa, can we know which line you were able to load? Oh, El Rafa, thank you for that information. We understand that you are the one that loaded the Airtel line successfully. You've got the fastest fingers for this first session. If you've loaded the Glow, MTN, and 9 mobile lines, please can we signify? Please signify in the comment section. Please signify in the comment section. Pediatric partners. Pediatric partners, congratulations. We understand that you two have fastest fingers today, so you are our second winner. MTN winners, 9 mobile winners, where are you? Okay, while we wait for the MTN and 9 mobile winners, we go into the second slide of airtime recharge numbers. And I'm going to do the same thing I did earlier. I'm going to count down from 5. And once I get to 0, you are going to see a new set of numbers. Are you ready? Are you ready? 5, 4, 3, 2, 1, and 0. Here you have it. New set of numbers. Fastest fingers. New set of numbers, fastest fingers. New set of numbers, fastest fingers. We have a new set of numbers, fastest fingers first. Can we hear the winners put in the comment section if you want that? Please drop the name of your clinic as well as the line you were able to recharge so that we can celebrate you on this platform. To have, to be the fastest among so many people in this meeting is not an easy feat. EB Dave Dental. A big round of applause for EB Dave Dental Airtel. A big round of applause for EB Dave Dental Airtel. You are the winner for Airtel in this second round. You are the winner for Airtel in this second round. EB Dave Dental, congratulations. A big congratulations to you from all of us at THT. You are the winner in the second round. We hope you can win more in the coming rounds, as well as other previous winners. We're waiting for more winners, more winners, more winners. Pediatric Partners is here for business. Pediatric Partners, they are here for business. Even though they attend to children, they are not going to play children mode here today. Pediatric Partners, congratulations. Second consecutive winners at this round of airtime recharge cards. All right, I'm going to do a countdown again, and we're going to roll out the third slide. We're going to roll out the third slide of numbers. Are you ready? Are you ready? Are you ready? Don't blame yourself if you've not been successful in the first 2 slides. It's that phone that you should tell to receive fire. Okay? Oh, we have a new winner. Soft Shell Specialist Hospital, we understand you won 9 mobile. Congratulations. Congratulations. We hope you can win more in the coming slide. So the third slide coming up now. Third slide coming up now in 5. Third slide's coming up in 5, 4, 3, 2, 1, and 0. Here you have the third slide now. Fastest fingers, fastest fingers. I believe your phone will cooperate now. Your phone will cooperate now. Your phone will cooperate now. It's time to power that phone with airtime. You know there are some airtime that are alert. There are some airtime that are alarm. This one entering your phone is alarm, not alert. If you were successful, please drop it in the comment section so we can celebrate you. If you were successful to load it, please drop it in the comment section so we can celebrate you here. THT is very, very, very proud of every one of its providers, so we'll take every opportunity to celebrate you that we have. Winners, we're waiting for winners of this third slide. Winners of this third slide. Where are the winners? Please don't be shy. This is a testimony. It's not easy to come around airtime anyhow in this Nigeria. Royal Specialist MTN, congratulations. Royal Specialist you are doing well. We see you. You did well. We hope you will do better. Royal Specialist, congratulations. Any other winners? Any other winners? Waiting for more winners? Waiting for more winners? Waiting for more winners. Somebody must have loaded the airtime. That airtime is speaking in tongues on your phone. Allow it to speak into the comment section. Waiting for more winners. We want to celebrate our providers even though this is a virtual session, we want to use this little way to celebrate them. First Hospital, you are the one that won this round for Airtel. Congratulations. Congratulations. Big congratulations from us. You have shown that you are really the first. You have shown you are really the first. All right. In a few seconds, I'm going to start the countdown now, and we're going to go to the fourth and final slide for this session or for this segment. The fourth and final slide for this segment. So if you have not been successful, you still have one more chance. It's not be the person who starts race now in the finish. The fastest person to take off from the start line is not the person to get to the finish line. So knock your phone, pour anointing on your phone, spray on your phone, wipe the phone, do anything you can do to the phone. It will cooperate with you now. Okay. The countdown begins at 5, 4, 3, 2, 1, and finally 0. The fourth slide, there you have it. The fourth slide, there you have it. Interesting numbers. Don't worry, don't get confused. Just go to where your line is and load. Don't be jumping between two lines. Just pick one line, precise, fire, and you see that you'll be the winner. Take my word for it. We're waiting for the winners. We know we have fast fingers already. We're waiting for the winners of this fourth session. Winners, don't cover the testimony. You know when you talk about this testimony now, you don't know whether THT will just decide to dash you times 10 of it. So if you have loaded it, just type it in the comment section. Thank God I am the fastest. Pediatric partners, you will not be. Why you are supposed to be treating children. You are now not doing children mode here. Pediatric partners, congratulations. You've loaded the glow again. Pediatric partners, you have loaded the glow again. We will change your hospital from children treatment to adult treatment. All right, more winners, more winners, more winners, more winners. The numbers are showing on all of the platforms where you've joined us. So more winners. Let's celebrate you here. You are very important to us. Okay, I understand some of us are shy, even though we are joining virtually. Please don't be shy. There's a popular statement that I like. It's called, "Why shall I shine?" So thou shalt not shine. So shine is not allowed. Thou shalt not shine, because why shall I shine? All right. We continue with the rest of the presentations and the discussions for today's session, day 2 of the THT Provider Forum. Very quickly, please, let's get back to our notes and to listening mode, because we're going to be hearing from another esteemed speaker very shortly. So please stay tuned as we introduce the next presenter.
All right, we're back. Thank you to everyone that participated in that. And you're also welcome for all the goodies that we gave you. So we'll be moving right along to Professor Akin Oshibogun's presentation. But before we go, I'd like to mention again to our doctors that we haven't forgotten you. We're giving out CME points. So please go to the comment section or the chat box, and there's a form for you to fill. Please give us your email address, your phone number, and your name to stand a chance to win some of our CME points. Don't miss out on the goodies. All right. Professor is going to be talking to us about building better healthcare delivery post-pandemic. To acquaint us with Professor and what to expect, I'll be reading some of his works and his profile for us just now. All right. Professor Akio Shibogo is an experienced professor with a demonstrated history of working in the medical practice industry. He's skilled in epidemiology management, global health, healthcare management, and healthcare. Strong educational professional with a FMCPH, National Postgraduate Medical College of Nigeria, FWACP, West African College of Physicians, is focused in health, healthcare administration, management, healthcare financing from the College of Medicine, University of Lagos, Columbia University, New York, and University of Zagreb, Croatia. Please let's make welcome Professor Akin Oshibogun for his presentation. Please a round of applause wherever you are. Let's do the applause.
Good morning, ladies and gentlemen. It's indeed a pleasure for me to have this interaction with you. I thank THT for inviting me, and I commend them for having this providers forum. I guess the objective is to ensure that the providers and themselves are on the same page so that we can be able to discuss and negotiate best business in a better manner. I've been asked to talk about improving healthcare delivery post-pandemic in Nigeria. Therefore, I will want to discuss with us how we can build our health system or rebuild our health system following this stress that the pandemic has imposed on the health system. But therefore, my presentation will emphasize the security implication of health and, of course, try to define resilience and sustainability. Resilience is the ability of a health system to recover from shock. There can be no better time to discuss this than now, because our health system has indeed been subjected to a very severe shock. Whether it's able to recover rapidly will depend on you and I. It will depend on what we choose to do to make it more resilient and in future to be better able to stand any other shock that may come its way. And then, of course, the concept of sustainability requires us to look at the resources in our environment and see the best ways by which we can deploy those resources to ensure the delivery of required health services in a way that our economic and social system can sustain for a long time. We look at the challenges facing the health system because that will help us to design the solutions that we will require. Of course, health is at the core of human security, and human survival and good health is the only basis of all other security efforts. As we can see, I think COVID has been a very good teacher in this respect. We can see how the economy was shut down for the larger part of 2020. Not only the economy of Nigeria, economies globally were shut down because communities had to be subjected to all kinds of lockdowns. And in the United Kingdom, we talk about tier 1, tier 2, tier 3, tier 4, and tier 5 lockdown areas. There's no doubt about the social and economic impact of the COVID-19 outbreak. And that is just an example. There are other health epidemics or endemics that have been exerting tolls on our social and economic life. It's just that we've not paid enough attention to them. So if we look at all this, we can see that it provides us with the argument for higher political and budgetary prioritization of the health sector. We need to pay more attention to the health sector. And as I mentioned earlier on, there has not been any better teacher than the COVID-19 outbreak. The only other question is whether we are also good students, whether we've learned anything from the COVID-19 pandemic and its effects on social and economic sectors. We also know that the health of soldiers and populations have determined the course of wars. We know that in Vietnam, malaria was the unseen enemy and it killed more troops than enemy bullets. In fact, it was probably one of the reasons why the Americans had to exit Vietnam, because once the body bags started arriving the American shore, the political support for a continued foreign war was no longer there, and the leadership of the American government had no choice but to order a withdrawal of American troops from Vietnam. We also know that, of course, the Spanish conquistadors were able to defeat the Aztecs in South America simply because the Aztecs were under an epidemic of smallpox, which decimated their fighting forces and therefore made it easier for the Spanish conquistadors to overcome them. We will just mention briefly that the Spanish conquistadors had the benefit of having learned about smallpox vaccination from an African slave, who had taught them, the use of cowpox. So they protected themselves and were able to conquer the Aztecs in South America. So we can see that health is in fact a security concern. And we know from global epidemics, HIV, SARS, avian flu, they generate enormous fears, panic, and disruptions to socio-economic life, and they've cost countries billions of dollars. We also know that ill health in children, leads to deprivation of knowledge security. So, absence of health security will result in diminished knowledge security, will also affect food security, will affect all other aspects of human security. And ill population leads to poor economic productivity and human deprivation with attendant violence and crime. So it starts a vicious cycle. The United Nations, of course, have realized this, and in 1994, the UNDP annual report, was titled New Dimensions of Human Security, and it established the initial parameters of the field of non-traditional security. Health security was one of the 7 fields of human security that was identified. The traditional security will be looking at only physical security, but now we know that there are other aspects of human life that can also threaten human existence, and security, of course, relates to anything that threatens human existence. And the United Nations Security Council's September 18, 2014 resolution on the Ebola, you can see that now health is on the agenda of the United Nations Security Council. So resolution 2177 was the second time that the United Nations Security Council had responded to a health crisis after the HIV/AIDS resolution in 2000, which was resolution 1308, and resolution of 2011, another resolution on HIV on 2011, resolution 1983. The resolution, the Security Council resolution, of course, was as a result of a conclusion that the Ebola epidemic will reverse peacekeeping and developmental gains. Of course, during the Ebola outbreak, Médecins Sans Frontières did request the United States to deploy the military, and on September 16, US President Barack Obama actually announced a military-led response in Liberia. So there's really no doubt that some health issues can really be of security concern. Securitization of health is not a new phenomenon. Outbreaks of bubonic plague in Europe in the 14th and 15th centuries, and rulers of city-states employed military force to carry out draconian disease prevention containment measures. We saw that in Liberia in 2014 during the Ebola outbreak. We also know that a third of the total population of Europe, almost 30 million people, plague caused their death. Plague developed into a classic national security concern. Of course, emergence and re-emergence of diseases, increased population mobility, bioterrorism, environmental changes, and transnational crime are all issues that are of concern to us, because it's now easier to have breakfast in Lagos and have lunch in London. Therefore, man in his travels can carry with him all kinds of agents of disease. So it's easier now to spread agents of disease than before. So globally, there has been formed the Global Health Security Agenda, consisting the partners include World Health Organization, World Organization for Animal Health, the performance of veterinary services, and other relevant global health security frameworks. The objectives, of course, were to accelerate progress towards a world safe and secure from infectious diseases, and then to promote global health security as an international priority. So the Global Health Security Agenda action packages are to prevent, detect, and to respond to threats. Of course, under prevention, you have sub action packages, and under detection, you have sub action packages, and under the respond item, you have sub action packages. So to prevent, detect, and respond to biological and other threats to health, a resilient and sustainable health system is required. So a resilient health system is one that is able to withstand or rapidly recover from exposed shocks. And a sustainable health system is one built on local capabilities and realizable local potentials, such that the community can maintain the system at all stages of its socio-economic development. In general, African health systems are facing severe and serious challenges. With just 13% of the world's population, sub-Saharan Africa accounts for 24% of the global burden of disease. This is shown on this slide. The dark areas are those areas that are really undergoing a global health workforce crisis. It is a pity, though, that while Nigeria is one of those countries that are already undergoing the part of those countries undergoing the global health workforce crisis, we are not doing enough to retain our health workforce. So we are also witnessing, unprecedented brain drain, in addition to the fact that we don't even have enough already. Well, this is just to support the earlier slide. You can see that Africa is just a tiny dot compared to Americas in terms of health workforce distribution. The global burden of disease is very high in Africa. We can see that the global burden of disease is very high in Africa, and we can see that the global health workforce is very low in Africa, whereas the global burden of disease is even lower in America, in the Americas, and we can see that they have a larger portion of the global health workforce. Well, this is just in support of the earlier comments, so we just move rapidly. The resource deficiencies are an important part of the problem, but may also be compounded by wrong policy choices and weak governance structures. The results in Africa, including Nigeria, in fact, Nigeria is performing worse than countries like Senegal. The results are weak, fragile health systems. Weak health systems make it impossible to attain national health goals and are also a threat to global health security. So if we just quickly look at the Ebola outbreak of 2014, a total of 20 cases were recorded in Nigeria, out of which 8 deaths were reported. Overall in West Africa, 11,300 lives were lost out of about 28,634 infected cases. Excluding Nigeria expenditure, a total of 2.27 billion were mobilized internationally for country response plans, and these countries were largely Liberia, Sierra Leone, and Guinea. Those were the countries that were between the three countries of Liberia, Sierra Leone, and Guinea. 359 million was lost in reduced economic output. That is aside from the funds that were raised externally to support those countries. In those three countries, 5 million children were not going to school due to closures, needs to support households, and the fear of health risks. In Lagos State, Nigeria with a GDP 4 times the added GDPs of Liberia, Sierra Leone, and Guinea, the estimated loss to the economy for the months from July to October 2014 was 540 million. Remember that the first case in Nigeria was in July 2014, and by October 2014, Nigeria was able to control the Ebola epidemic. But within those 3 months, Lagos State lost about $540 million. And that is aside from the cost of control measures, the cost of sanitizers, face masks, gloves, and personal protective equipment. Those were additional costs. So now to get our health system ready post-epidemic, or more importantly, or more appropriately, to get our health system ready for all times. Let us keep in mind the words of Girolamo Frascastoro some 450 years ago. He had warned that there will come yet other new and unusual ailments in the course of time, and this disease will pass away, but it later will be born again and be seen by our descendants. So our strategic decision should be to prepare a health system that is ready for all times, not just ready for the COVID-19 outbreak, not just ready for this pandemic. Our health system should be ready for all time. So the challenge, therefore, is to develop a health system that is strong for all times. It must have capabilities to meet the needs of the present while anticipating and preparing for the future. So some of the key issues with regards to the Nigerian health system, and this is not exhaustive: inadequacy of health human resources, I mentioned that earlier on, but in addition to that inadequacy of numbers, we also have poor management of even the human resource that we have. So there's relative unemployment of health workers, even in the presence of inadequate number of health workers. So it's paradoxical. You don't have enough, yet the ones that you have are not sufficiently engaged. And then we don't provide the appropriate work climate for the ones we have to motivate them to work, to motivate them to do their best. And that is why doctors and other health workers are migrating out of the country in large numbers. The recent figures published by the UK General Medical Council is really frightening. Each year we are losing almost 800 to 1,000 doctors to the United Kingdom alone, and we are producing only 3,000 doctors per annum. 1,000 is already going to UK. I guess another 500 or more is going to the United States. So we are producing doctors, but we are not retaining them. In addition, of course, there's the increasing interprofessional rivalry due to unclear job definitions. People train for one thing, but they want to perform a different role, which I will refer to as crass opportunism, because the admission criteria for every course is, spelled out, and every citizen is free to go and read and study for the course of his choice. But people going for one course and then they graduate and then they want to perform other roles. And this has been resulting in unnecessary beauty competitions among health professionals, strong interprofessional rivalry that has been slowing down the health sector further, in addition to the other challenges that the sector is facing. Of course, there's also insufficient public health financing of basic inputs. Over 80% of public expenditure is going into staff emoluments. There is very minimal resources available for capital development and for maintaining the existing infrastructure. So, and in addition, there's weak supporting public utilities. Municipal electricity supply is weak. Municipal water supply is weak. So each health facility has to more or less provide all these facilities for itself. It has to provide its own water through sinking of borehole. It has to provide its own electricity through operation of generators. And of course, when the funding is also not adequate, it impacts on the quality of service. So to build a resilient health system, we need leadership and governance, service delivery, health workforce, access to essential medicines, financing, health information system. These are the building blocks of resilient health systems, as canvassed by the WHO. But I'll just pick a few of them, because of time constraints, and we'll quickly discuss them. So, characteristics of good governance. If you can ensure public participation, those who are going to benefit from a health service have a right to participate in the design of such health services. They have a right to participate in the management of such health services. So all health facilities will have local inputs into how they are managed, and that will engender, some form of ownership among the members of the public. And the rule of law is also very important for governance, so that the conditions, the guidelines, the rules, everything is transparent, so that workers know how they will be assessed and they know on what basis they will be promoted. That's just an example. So once the rule of law obtains, that will be good governance, and it will result in better performance of the health system. A health system must be responsive, must be transparent, and must give accounts of public funds particularly, and give accounts of itself in terms of performance, must be able to annually inform stakeholders how it has performed for the year. And of course, the system must be drawn or operated in such a way that it ensures that there's equity and inclusiveness. There must be safety nets for the poor and the disadvantaged, so that they are not left behind. Of course, we must use efficient strategies, efficient methods to deliver the health services. And then in doing all that, another evidence of good governance is our ability to look far ahead in designing our health system. Good governance will produce results that are understandable and acceptable to the governed because of their level of participation in decision making and program implementation. Good governance can be expected to be associated with highly efficient government performance. Well, we'll take a quick look at the health workforce again, because without the health workforce, you can't build a resilient health system. And of the various resources required to deliver healthcare, human resources will perhaps be the most critical. The quality of the human resource will determine how best all other resources are deployed. We need to train, develop, and retain the manpower to make our health system function. You can't expect people to be committed, to be loyal to an organization, to be engaged in an organization, or to want to stay in an organization if the company does not care about them. So it is very important that we care about the work climate, and it is very important that we ensure that we motivate the health workers, so that they can stay and that they can provide quality health services.
Hello, we understand, to our dear participants, please, we understand that you are having difficulties with hearing the audio on Microsoft Teams platform. Please just hold on. Please just hold on as we rectify this. We understand, we get feedback from you that some of you cannot hear the audio very well. Please, a minute as we address this audio issue. Thank you. Please just stay tuned as we address the audio issues. Thank you. For participants on the other platforms such as Zoom and YouTube, Professor Shibogun is still with us. He's still with us, but he's just going to hold on while we address the audio issues on Microsoft Teams. So please just hold on while we rectify it for the participants on Microsoft Teams so that we can all participate. All right, Prof is going to continue right now. So um, participants on Microsoft Teams, please just confirm as soon as we activate his audio, please confirm that you can hear him in the comment section so that we are sure that you can hear now. Thank you.
So we must be prepared, and to be prepared, we need to refine our structures. We need to enhance our disease reporting system. We need to enhance our surveillance for diseases, and we need to enhance our response system. And we need, in this, on a long-term basis, to link academic centers to local and state health authorities so that we can marry the training and the delivery of services together, so that while people are in training, they're also exposed to practice so that they can learn from practice. And at the same time, we can leverage on the already trained manpower, the trainers in those academic centers, the specialists in those academic centers, so that their knowledge and expertise can benefit local and state health systems, particularly for research and particularly for disease monitoring and surveillance, so that we can analyze and interpret epidemiological data faster. We must provide enough funds to fund different aspects of healthcare delivery, including research, to provide evidence for decision making, to provide evidence for policy. We must engage our academic centers, as I mentioned earlier on, in this enterprise, so that we can be highly efficient in terms of producing results. In conclusion, a strong health system is better able to prevent disease outbreaks and respond faster in containing outbreaks when they do occur. Investments are required to strengthen the health system, and these investments will only be a small fraction or a fraction of the potential economic losses. So if you don't make the investments now, you will spend far more in containing outbreaks in future. I must thank you for your attention, and I wish you further fruitful deliberations as the forum progresses. Thank you. God bless.
Can we give Professor a big round of applause? Can we give Professor a big round of applause for sharing these insights? You would agree with me that those insights are breathtaking, and in some way they can be very shaking. But like the theme of this forum says, creating impact in chaos, irrespective of the chaos, we have to create impact. So it's important that with all this data, with all these findings, with all these insights, we are still able to cut through the noise and make sure that with the advisory that Prof has advised us today, we are able to get something working at our ends, especially in northern Nigeria. With such an insightful presentation, we understand that there are questions, but our moderator is going to be telling us and guiding us as to what to do concerning questions and other things that we have lined up for the session. Over to you, ma'am.
Thank you, Femi. Once again, that was such an amazing session by Prof. Just to echo what Femi said there on building back better healthcare delivery post the pandemic. I'm just going to give us some of the nugget of wisdom that Prof dropped for us. And the first one is that there's never been a better teacher than COVID. There's never been a better time to build better healthcare delivery and better healthcare structures. Now, the important question is, are we good students? Have we learned our lessons? Would we do better? Would we create better structures and better systems? Next thing he said that was very pivotal was that our strategic decision should be to have a health system that can meet the needs of the present as well as anticipate the future. So we have to have systems that can combat even issues that have not come to pass yet. Issues that we don't even know that we're going to face in the future. We have to have those kind of health systems, not just for the malaria of today, but for the COVID of tomorrow. Another thing that is said is that we have to develop local resources so we can combat global challenges. If our in-house manpower in the country is not enough, how then do we measure up to global challenges? So we have to start from our own home, our own family, so that we can meet the demands of the global markets. All right, so if you have any questions for Prof, please do drop your questions in the comment section or in the chat box. We'll collate these questions and we'll be back with a response. Thank you very much. I'd like to welcome somebody very important to us in the Total Health Trust family, our Head of Medical Services, Dr. Itayo. A round of applause for Dr. as she comes, please.
Good afternoon, everyone, and thanks for staying on the program since the beginning. Let me this slide. Okay. So we're talking about what? No. I should start talking. Good afternoon, everyone, and thanks for staying with us since the beginning of the session. This afternoon, we're going to talk about emerging stronger from the pandemic. The pandemic is still very much with us, sadly. Now we're talking about the third wave, and I'm sure since this pandemic started in February last year, in Nigeria at least, many of us know people or even have lost relatives from the pandemic. But then, there's light at the end of the tunnel, and we must start thinking about what to do post the pandemic. For many of us, we're still in survival mode, and if we've not started thinking about what to do post-pandemic, then certainly, it's not too late to start. So give you a few nuggets about what to do post the pandemic. And one of the first things is to glance back. It's been a long 18 months, but now we're wiser. When the pandemic started, we didn't know much about the pandemic. We didn't know how the disease was spread. We had all kinds of things. The medical world was not very helpful. And of course, it was all tainted very much by what we heard in social media. Everybody said something, and everybody was seemingly an expert on this disease that was so strange. But thankfully, we now know that this is a respiratory tract infection. It's spread in the air, and droplets could be on any surface, and that's also why we have to wash our hands regularly and make sure that we wear our face masks. Thankfully, we now have a vaccine. It came out faster than any other vaccine because, the world has always known about RNA viruses, so it was easier to develop a vaccine for this one. So now that the pandemic is almost over, we're in the third phase, one of the things we should do, to emerge stronger at the other end of the pandemic is to take a hard look at the past 18 months. Find out what worked. We're all still here. We're in business, and that's why we're able to have this program. You, our providers, are in business. That's why you're able to at least get some data to join the program. And then we also have to look at how did our business survive. Initially, everybody was scared of anyone with fever. Unfortunately, in this environment with malaria, people come with fever before you even know what is wrong with them. We also have to look at what the non-essentials we did away with, that helped us to at least stay in business and improve our bottom line. What lessons have we learned, and what did we learn about ourselves during this pandemic? In the past 1 year, we would also notice that a lot of patients may have moved to other places. Sometimes it's because they probably can't afford to pay for the services anymore. It may also be because, they felt they didn't get very good service when they were ill. Because initially, anything with fever, some providers just didn't touch them, and rightly so, because the way COVID is spread. So moving forward, we're now going to look at, we need to take an inventory of what we did differently. And it's got to be realistic. We need to look at the skills we possess right now. I'm sure many of you have lost staff. We need to look at the equipment we've acquired during the pandemic and the things that have helped us to achieve our goals. So we also need to look at what we need and how we compare with competition. Even as a business, THT has had to do that to stay in business. And we need to know what separates us from competition, because competition is now quite stiff. So we need to know, we need to know how our hospital, differs from the other, and what would make patients come to us, because the only way a provider can stay in business is to have patients. Moving on from there is the need to zoom in on what is really important. And in emerging from the pandemic, we not only want to emerge as a stronger business, but also as a better human being. And we've all been forced to refocus on our relationships in the past 1 year. When the lockdown started, people who had hardly spent more than 5 hours together in any one day had to now spend 24 hours in a day. And people learned new things about their spouses, about their children. But generally speaking, I know that relationships became stronger. Some broke, unfortunately, but most relationships became better. But then we've also found out that we are all better off for it. We need to keep that focus, the focus we had on the people who are really very important to us. We had more time to make calls, even for people we couldn't see. Because it's also been shown that when we're happy and there's a good work-life balance, we're generally more productive and happier. There's also a need to pursue collaboration with providers who have similar ideas and similar visions with us. It's a win-win. Like they say, the sky is big enough for all birds to fly, and they never clash in the sky. So we found out that there's no one provider who has everything. If there's a provider close to you who has an ambulance you could use, it's better to give him that business than look for another one very far away. If there's a specialist close to you, it's better to give the specialist that business than insist on doing it and not doing it well. So we need to think about this strong at the end of the pandemic. What do we do? We need to move forward. And once we've taken the last 3 steps, we need to check up the past and then zero in on the future. Like I said, we need to assess how our competitions are emerging. The grass is always greener on the other side, but we never know. Many people are in survival mode, but they still look okay generally. So we may think our business is not doing well, but the other guy too may not be having fun. But so we need to learn as much as we can from everyone we can. So if there's something they're doing that is working, then we need to know from them. Ask them, what are you doing that is working? Why are we not succeeding in this area and you are succeeding in that particular area? We also do everything we can to improve brand loyalty. We need to reaffirm and constantly reiterate to our patients that we're there for their good and we're there to do good business. So, because if we don't, they move on to somebody else. And then we also need to invest in our business. A lot of people have made money from COVID, but sometimes people don't know what is coming next, so they are hesitant to invest in the business. But it's been shown that during crisis period like this, people who invest in their business actually do better than people who don't. So lastly, I want to encourage all of us not to go back to our old ways. A few years ago, we had Ebola, and we were all very scared. Thankfully, Ebola was very short-lived. But then there were sanitizers everywhere. There were hand-washing solutions everywhere. There was a sink everywhere. And it's been less than a decade, but we've all forgotten. Now we're back to COVID. And who knows, we don't know, maybe we'll have a shorter time still before the next pandemic hits, because we're developing all kinds of antibiotics. We're using all kinds of antibiotics. Organisms are getting resistant to all kinds of antibiotics. And so we must be very conscious of this pandemic, the pause we've had, and the tough lessons we've had to learn. We must be ready to put our business into drive, and we must not unlearn infection prevention control that we learned during this pandemic. We must also embrace digital solutions. One of the speakers who spoke earlier spoke about telemedicine. So we must encourage, if a patient doesn't need to come to the hospital, we don't need to get the patient to the hospital just to make money from him. If it's something we can deal with on the phone, then it's better to deal with it on the phone. That reduces the stress. It reduces the stress on the hospital resources. You are providers for this forum. We know that we're going to emerge stronger from the pandemic, and we also want to reassure you that THT is here for you during this pandemic, as you've seen, and for whatever else comes along in the future. Thank you, everyone, and thank you very much for listening.
Can we make the applause bigger? Can we make the applause bigger? That was very, thank you very, very much. That was Dr. Eitayo Abejide, the head of medical services here at Total Health Trust. And she has done a very good recap of where we have been, where we are, and where we are going to. We know very well that COVID has not left. We are still dealing with the pandemic. Wave upon wave of the pandemic seems to affect how we plan and how we schedule, how we do business. But irrespective of that, we know that resilience and innovation can see us pull through. We cannot afford to do things as it was being done in the past. We must move forward and do that deliberately. As providers, we know that we sit and we lie at the forefront of this war against COVID-19, and as such, the world really needs